Welcome to Gulf War, the battle after the war. Today I've got a lot to cover, so I'm going to try and burn through this as quick as I can. It's all study related, and I know how everybody is not so happy about studies these days. But keep in mind, these people that are doing these studies are doing their best to help us out. They have our best interests at hand. So it behooves us, like I've said in previous casts, to get out there and go to these reputable studies so that they can figure out what's going on with us and hopefully someday find a cure, if not for us, for others. Unfortunately, we are the guinea pigs. So this study is down in Miami. You're probably familiar with Dr. Klimas if you've been watching any of the Gulf War videos on YouTube, and this is her study. So I've been in contact with them for the past probably 2 months, and they've sent me some information to share with y'all. So I'm gonna go ahead and get started here. There's a whole ton of flyers. What I'll do is provide these flyers and links if I can on my Gulf War page at Gulf War Vets, and you're more than welcome to go there and read through each one of these. There's a lot here. So this one's titled Gulf War Veterans Illness Research Program. And their mission is to discover knowledge and create innovations that advance the health and care of veterans and the nation. And they've done a lot for us in the past 20 years. So their research standards is based on rigorous science, and the research produces data that drives clinical policy and translates to improved health care. The next question is, will the research help veterans, and is it veteran-centric? The only research program focused entirely on veterans' needs is this one. Their 60-year history, 3 Nobel laureates, 6 Lasker Award winners. Important discoveries and inventions are the device's first liver transplant, early work on the cardiac pacemaker, radioimmunoassay, CT scanner, and then the treatments for TB, first large-scale clinical trial, hypertension, and heart failure. And it continues on, first rehabilitation program for blind people, linked smoking with cancer of the respiratory tract and lung, developed a nicotine patch for smoking cessation, and found that the insulin pump controls diabetics' blood sugar and weight better than multiple daily injections. Identified best treatments for colon cancer, psychosis, stable angina, high blood pressure, and other conditions. Developed a computer-controlled ventilator system for the critically ill patients. Developed the Seattle foot, first prosthesis allowing amputees to run and jump. That's amazing in its own right. Recent VA researches advances pinpointing genes for diabetes and obesity, brain-computer interface to restore independence to paralyzed veterans, proper use of coronary angioplasty, courage trial, vaccine for shingles, prolonged exposure therapy for PTSD, long-term study of PTSD and TBI starting pre-deployment, mechanism of respiratory distress syndrome, mechanism of pain and spinal cord injury, effects of reduced work hours of medical residents on patient outcomes. And then it goes on to explain their R&D a little bit, characteristics of VA research. It says VA research is an intramural program. Researchers must be employed by VA, usually 5 to 8 years or more. Having research and clinical care under the same roof is a unique strength. VA research connected directly to nation's largest health system, being intramural. 70% of investigators are physicians, links researchers directly veterans, needs, facilitates implementation of research results. Unique research resources include electronic health record, cooperative studies program, clinical trials, telemedicine, drug safety center, and rehabilitation research. Office of Research and Development does not oversee all VA research, and RECs, etc. Epidemiology section, the Biomedical Laboratory R&D Service, Molecular, Genomic, Physiologic, and Clinical Science R&D Service is test new treatments and compare existing therapies. Health Services R&D Service, Quality and Organization of Care, cost effectiveness, and basis of VA's ability to present its excellence and quality. Rehabilitation, R&D service for the disabled individual, improve functionality, capacity in their persons, families, communities, and workplaces. Organization of the VA research in U.S. News and World Report attributes the high quality of VA patient care to consistent examination of the processes and procedures that go into caregiving systems. Now, I only agree with this in the research portion of the VA system. We all know the medical VA system is broken, so don't apply this to that, and don't be offended by this statement, because it is only true in the research and development area. Areas of research sponsored, designated research areas, age and age-related changes, acute and traumatic injury, military occupation and environmental exposures, sensory disorders and loss, mental illness, substance abuse, special undeserved high-risk populations, and health services and systems. And the type of research that is sponsored is investigator-initiated research, metric review, large-scale multi-site clinical trials, cooperative studies program, Center of Excellence, all services, service-directed research, special initiatives, for example, Gulf War illness research, research career development awards. All projects undergo strict scientific review. Going on to OEF and OIF, that's deployment-related research and current and all conflicts, prosthetics, hearing and vision research, PTSD, rehabilitation, deployment-related research, highlighting specifics for current conflicts, TBI and other neurotrauma, polytrauma, access, chronic care and the new veteran, collaborations with DoD. The Gulf War Illness Research Program, the background to that is a proportion of veterans returning from the 1990 to 1991 Gulf War reported various chronic health problems to a greater degree than non-deployed Gulf War era veterans. Persistent headaches, joint pains, extreme fatigue, cognitive problems, gastrointestinal difficulties, sleep disturbances, skin abnormalities, and many others. Background on that is more than 30% of veterans who served in the 90 to 91 Gulf War have had military service connection conditions. 3,300 have been service connected for the special undiagnosed illness category. And that's as of the time that these flyers were made. These flyers are fairly old. To better understand the health conditions and health problems experienced by Gulf War veterans, VA, DoD, and HHS have supported research projects related to Gulf War veteran illness. VA DoD funding for the research of Gulf War veteran illness totaled $326 million from fiscal year 1997 to fiscal year 2007. The federal research portfolio has 5 focus areas: brain and nervous system function, environmental toxicology, immune function, reproductive health, symptoms, and general health. And then their research portfolio is as follows. While each department carries out its GWVI research portfolio independently, there is coordination to avoid duplication. The research subcommittee of the Interagency Deployment Working Group is currently the group that coordinates this research. It compiles an annual report to Congress on federally sponsored research on Gulf War illness. Annual reports for 1997 to 2006 have been posted at the following URL, and I'm going to just pop that up on the page because it's too long. The research portfolio on GWVI program has been at the forefront of the field from the onset. In 1995, VA initiated the National Health Survey of Gulf War veterans and their families. First 2 phases use surveys of self-reported symptoms, 15,000 Gulf War veterans and 15,000 non-deployed veterans. Gulf War veterans were twice as likely to report symptom problems such as joint, muscle, respiratory, gastrointestinal, skin, chronic fatigue, symptoms of PTSD, and others. Final phase completed recruitment in 2001 relied on complete physical exams of 1,061 Gulf War veterans and 1,128 non-deployed veterans. 10 years after deployment, military service in the Gulf War was associated with increased of chronic fatigue syndrome, increased prevalence of PTSD, other psychological disorders, and poor self-reported quality of life. No significant physical health outcomes of clinical concern among spouses of deployed or non-deployed veterans. Gulf War deployment was not associated with significant differences in frequency of birth defects. In 1998, VA began planning for 2 large multi-site clinical treatment trials, exercise behavioral therapy trial, or EBT, antibiotic treatment trial, or ABT. Eligibility to participate: all veterans of the 90-91 Gulf War with at least 2 to 3 of these symptoms: fatigue, musculoskeletal pain, or cognitive dysfunction. Symptoms must have begun after August 1990 and persisted for more than 6 months. Veterans must have been symptomatic when the study began. The VA conducted the 9.6 million EBT study between 1999 and late 2001. 1,092 veterans participated at 18 VA and 2 DoD medical centers. All groups continued their usual health care, 3 experimental groups: cognitive behavioral therapy, exercise, combination of CBT and exercise. CBT with or without exercise provided modest but significant improvement in physical function, primary outcome, ORI 84, I think you can Google that, and then both CBT and EX. Mental health functioning, cognitive symptoms, fatigue, distress, no significant effect on pain. ABT enrollment began in May 1999 and included 491 Gulf War veterans at 26 VA and 2 DoD sites. Trial was completed in December 2001 at the cost of $10 million. Primary hypothesis: antibiotic treatment with doxycycline for 12 months would improve the health status of patients with chronic symptoms who tested positive for mycoplasma infection at baseline. Secondary hypothesis was doxycycline treatment would reduce symptoms of fatigue, pain, and memory problems. Doxycycline treatment would convert patients who were mycoplasma positive to mycoplasma negative. Study did not identify a new treatment modality for Gulf War veterans. VA supported a study, Eisen et al., 2005, to assess and compare the prevalence of health conditions in deployed and non-deployed Gulf War veterans. Fibromyalgia, chronic fatigue syndrome, skin conditions, dyspepsia, physical health-related quality of life, hypertension, obstructive lung disease, joint pains, peripheral neuropathy, just to list a few. Study concluded that 10 years after the Gulf War, the physical health of deployed and non-deployed veterans was generally similar. 4 conditions were more prevalent among deployed veterans: fibromyalgia, skin conditions, dyspepsia, and chronic fatigue syndrome, or CFS. Ongoing research, clinical trials of treatments, biomarkers, amyotrophic lateral sclerosis, or Lou Gehrig's disease, MS, and funding for other studies. 3 pilot clinical trials are currently underway to test new therapies for ill Gulf War veterans: sleep disturbances, CPAP, gastrointestinal problems, feasibility of performance, CBT via telemedicine. You have to bear with me, my voice is starting to go because of that inflammation in my throat. Another major focus of VA's Gulf War research portfolio is to identify objective markers that can distinguish ill Gulf War veterans from their healthy counterparts. Such biomarkers serve several purposes: provide vital clues to understand mechanisms responsible for how and why these veterans are ill, identify potential targets for the development of new therapies, provide objective measures for testing the effectiveness of new therapies. The VA currently funds 12 such projects ranging from genetics and genetic markers, advanced neuroimaging procedures, altered protein profiles in blood or cerebral spinal fluid. One of these projects recently identified differences in the coagulation system in the blood of ill Gulf War veterans compared to their healthy counterparts. ALS Review, a review of the available published literature, and concluded that Gulf War and other combat veterans may be at increased risk for developing ALS, also known as Lou Gehrig's disease, as a result of their military service. The largest prevalence study included in this review was funded by VA in cooperation with DoD. The study included all Gulf War era veterans, identified and confirmed ALS cases occurring over a 10-year period by medical record review. The rate of ALS Gulf War veterans was 6.7 per million versus 3.5 per million for other military populations. VA expanded the study to include a national register for veterans with ALS and a genetic tissue bank. Identify all veterans with ALS, not just Gulf War veterans. Provide a mechanism for VA to inform veterans with ALS about clinical trials and other studies they may be eligible for. VA continues to fund other ALS research, including clinical trials and animal models of the disease, to study potential disease mechanisms and test new therapies. There are persistent concerns about the risk of developing MS in Gulf War veterans. VA will begin a large study in 2008 to identify the date of onset and clinical subtype of service-connected cases of MS occurring in Gulf War veterans between 1990 and 2006. The study will also attempt to quantify the risk for developing MS in deployed versus non-deployed Gulf War veterans, as well as the risk for developing MS in Gulf War veterans potentially exposed to smoke-free oil wells or sarin. Another VA project is examining the overall and cause-specific mortality risk of ALS, MS, or brain cancer in more than 620,000 Gulf War veterans and assessing in-theater exposure characteristics associated with those deaths. Fiscal year 2006, VA supported a $12.9 million in 67 Gulf War veteran illness research projects. These projects examined brain and nervous system function treatments, environmental toxicology, Gulf War exposure models, immune function and symptoms, general health biomarkers, and epidemiologic studies. The fiscal year 2007 VA supported $22 million in Gulf War veteran illness projects. $15 million was for a contract between the Dallas VAMC and University of Texas Southwestern Medical Center for research related to illness affecting Gulf War veterans. The fiscal year 2007 annual report is currently in concurrence. And the other thing that they wanted me to put out there is there's a special study for Gulf War veterans, females that served from 1990 to 1991, between the ages of 40 to 70, suffering from the following symptoms: fatigue, mood and cognitive complaints, joint pain, stiffness or muscle pain, difficulty sleeping. And the opposite side of the spectrum, they want female veterans if you're a healthy Gulf War veteran as well. You may be eligible to participate in an ongoing clinical research study and clinical trials which may be beneficial to you or someone you know. Individuals who participate will be compensated for their time and receive a free immune checkup. And this is down in Miami. It's at the Miami VA. The contact information for this is area code 305-575-7648. Or you can email them at vhamigwi at va.gov. And I definitely recommend doing that. I've made contact with them as well. Like I said, they're the ones that provide me all this information for you to follow up on. The second one looks like it might be similar. It's veterans, all Gulf War veterans from 90 to 91, between the ages of 40 to 70, suffering from the same symptoms. And they want to know whether you're healthy or if you have these symptoms. And you also may be eligible for the same thing. And it's the same contact information. It's 305-575-7648 or VHAMIAGWI@va.gov. I would say give them a ring or give them an email, and they will respond to you and go from there. It's a reputable study, and it's something that will benefit all of us if they can complete these studies and gain more knowledge and information. So that's pretty much all I have for you today. I buzzed through it pretty quickly, but I'm gonna upload this stuff to my page, like I said, at Gulf War Vets on Facebook. And I will try and provide these same links on my YouTube channel at the bottom. If not, then like I said, at Gulf War Vets, that's where you'll find it. So it's been a pleasure going through this today. I hope everybody has a wonderful rest of your week. And don't forget to hug a vet.